Joining us now is a medical doctor, Tuyi Mebawondu. Good morning. Good morning. Thank you for joining us on TVC Breakfast. Yes. Now, for years, we've always been talking about malaria intervention. We're fighting malaria. And one wonders, is it so difficult to tackle, or is it the fact that we are not properly checking our intervention to see how much we have achieved and what exactly is the challenge in bridging the gap?
First and foremost, the will is the most important thing. You must be able to gather the political will, mobilize funds, mobilize human resources, and as much as possible, take your intervention to as local as possible.
But we have that.
Now, this is the deal. The thing is that now people are bringing money, they are bringing material, they are bringing resources. These resources are being, misused or actually taken away. So again, the point of accountability is for people to deeply understand the role they have to play, not just in the prevention of malaria, but also to ensure that these tools are properly understood, what the people need are properly disbursed to them, and then the monitoring and evaluation, you involve the local community. If you're not taking it to the local community, because again, one of the major things we have is actually the lack of sustainability of most of those interventions we've done. Now, when we started with rollback malaria, we thought we have a bullet, a magic bullet. But lo and behold, down the line, we saw resurgence of malaria.
Yes.
And now we're back. So when you look at it, because you see, preventing malaria involves three living things and the environment: the human, the mosquito, the parasite, and the environment. You must be able to carefully, deal with those factors in those four things that really enhance malaria. And then we are seeing climate change now, ensuring that malaria is coming back in a way, even in a country where we're not supposed to see it. Nigeria should be able to really do a big, hairy, audacious goal to say that, here and no further, we can't, actually eliminate malaria. Because smaller countries have done it. Mauritius have done it, Egypt has done it, Morocco have done it, even Iraq eliminated malaria, Paraguay eliminated malaria. So what is our problem? That we cannot get something done.
Earlier you mentioned political will. When it comes to some certain issues, it's easier to say political will, but when you say political will, what do you mean actually? Because the will is there. The government has always says it is committed to fighting malaria. Initiatives have been put in place. When we mention political will, it's confusing.
Political will mobilizes fund. That's very key. Finance is very key in any health intervention. Political will mobilizes human resources because, let's face it, now you need to really, kickstart some malaria advocates at the local level. These are people that you need to train. They must have the requisite knowledge. Even if you look at our training system, everything is wrapped around what is the need for me, what can I get? Okay. Not thinking in terms of long term. And then
that is more of a mentality thing.
Yes, yeah. What's the finance? Because again, you need leadership. Leadership has to come from the head. Where is the finance to drive all those critical training? Now look at us. It's quite challenging that even resources we're using, we cannot manufacture long-lasting insecticide nets. Most of those chemicals from abroad come from abroad. The drugs, we're getting resistant now. The ACT is becoming resistant. So in reality, what we need to do is not just to think of more talk. We need to see a lot of action.
All right.
At the local level.
All right. Time, I'd like for us to look at the issue of diagnosis and treatment, because if you listen to what the woman in the report was talking about, it seems like it comes with a different kind of disease, illness, in terms of the fact that you treat, it is resistant, they call it drug-resistant malaria, which is a kind of a different strain that we'll find now, and it's sometimes said to be very, very dangerous. What is the cause of this?
Indeed, not just against anti-malaria, but also a lot of antimicrobial antibiotics. We are getting resistance to it. That is why, in reality, we need to look at all the aspects of malaria control project. It's not just about diagnosis and treatment. Though early diagnosis, that's the key word. Early diagnosis, treatment, appropriate drug treatment is key, And then now, what is important is that we must be able to safeguard the molecule we have. The only way we can safeguard it is rational use of those drugs. It's not that for every time you feel tired or you feel weak, you then go and swallow anti-malaria. Because as ACT is failing now, what else do we have to do? Do we now have to get back to a situation whereby without pre-drug situation whereby people can easily die of malaria? So for me, we need to look at, well, the vector, the indoor residual spraying, okay? We need to look at how to protect the vulnerable groups. We need to look at herd immunity, how well built the immune system of the community is all about. It's an all-encompassing thing. It's not just about waiting and looking at just the drug for the malaria. Nutrition,
preventing it.
Yes, prevention is key. And then, this education should be able to focus on prevention, rational use of drugs, and of course, we must be able to back it with some rapid testing that can help us know the trajectory. I cannot really remember the last survey on anti-malaria resistance in this country. We need to update that on a yearly basis and understand where we are in the scale of things, so that when the resistant malaria crops on us, we don't then have to rely on
that we don't do well with data in this part of the world. I wonder how much that is impacting.
Without data, you cannot achieve anything. We must be able to cultivate that habit of using data. Now, it looks mathematical and looks so confusing, but that is where your decision should be. When you aggregate data and look at your data, you understand that, wait a minute, we're in trouble. Like the woman was saying, if you have to treat malaria often and often and often, there's something wrong.
Yeah.
Are you really treating malaria? Is the child having low immunity? Is the malaria resistant now? Is the drug not working? Because again, we see a lot of fake drugs. These are some of the things that a lot of fake drugs. So how do we assure the quality of the drug that is supplied to the place? Even some of those drugs may be expired, and then they find a way of bringing it back, to be used by those people. Now, again, the key thing is vigilance. The vigilance is such that you must be able to take decisions personally and look at what you need to do to protect yourself against malaria.
Okay. Trying to works that
we have to leave it at this point. The conversation will definitely continue. Thank you for your time. Tuyi Mebawondu.
Thank you.
All right, so looking at all of this now, the issue of at the primary healthcare centers and these villages that don't have access to treatments because drugs don't really get to them, and even if the drugs get to them, the primary healthcare centers are not that equipped to take on the treatment there. What should be done in this regard?
Again, the basic thing that can actually turn around our story about malaria is to embrace universal health coverage. The universal health coverage will ensure that access, there's a financial access, there's real physical access to all, and a knowledge access to this care. Now, the knowledge access is, part of this thing. You have to educate people. You have to let them know what to do, how to early identification of malaria, especially among the under 5 and the pregnant women. Then, this financial access is that we must design a way to be able to put money into the hands of people that they can be used primarily for predominant endemic disease in that community, especially malaria. Because, like the woman was saying, you saw that she was experiencing a problem with financial access to get treatment for malaria. The third thing is actually in terms of the facility there. Now, more than 200,000 primary health care centers in Nigeria, less than 10% of them are working. Yeah. No human resources, no equipment, the massive underutilization of those primary health care centers around the country. We must be able to rethink a way to maximize these primary health care centers.
What would be a rethinking, in your point of view, as an expert?
Yes, again, I saw Bill Gates Foundation trying to do a lot, trying to revive quite a lot of those primary health care centers, trying to put funds in there. First of all, it must be judiciously used. Then, one of the things, the challenge of conflict is also affecting access to some of this. That's why peace and ability to really assess this is key in any environment, or else we'll end up with resistant malaria, we'll end up with more death, because in Nigeria, every 100 million cases of malaria, 300,000 are dying. That's a huge thing.
It's a huge
So the WHO is insistent on 2030 mark for eliminating malaria. Are we on track? Would we join other countries with all of the evaluation you have made?
We're not going to join any other country. 2030 is just 10 years ahead of us.
Yeah.
We're still battling with control of malaria. You know, because there's a control. Once you achieve control, you get to pre-elimination stage, you get to elimination stage, then you get to what we call prevention of reintroduction of the malaria into the community. If you want to do elimination of malaria, you know what elimination means is that there's a zero transmission of malaria at the local level. If you eliminate from different community, then it becomes eradication. If you eliminate in different countries in the world, it becomes eradication. So at the point of elimination, how do you get zero transmission? We have not been able to do proper control.
So we're not
moving
anywhere. Wow. We'll leave it here now. Tuyi Mebawondu. Thank you for your time.
Thank you.